Doctor, what happens to the labia majora when women go through perimenopause?
Okay, so the external female genitalia is influenced by the hormone estrogen, and the thickness of the labia is at its peak during our reproductive years, and it declines as we age.
I see.
So during perimenopause or menopause, the rapid decline in this hormone causes a reduction in the volume and also the tone around the labia majora.
Okay.
And in fact, the skin surrounding the pelvic area also looks a bit different in discoloration, and this is because of the reduction of blood supply around the pelvic area.
I see.
So aesthetically, what women can see is that the skin becomes thinner and also some skin wrinkling. And in terms of functional, they may complain of dyspareunia, which is painful during sexual intercourse, which can affect intimacy and of course the overall well-being as well.
So, doctor, any non-surgical solution for this condition?
So we have hyaluronic acid injections, which
Okay.
can restore the volume loss, and usually the results can last anywhere between 12 to 18 months, depending on the type of the HA that we use.
I see.
And this can help with skin hydration and also the volume loss, and this can address both the aesthetic and also the functional concerns in women.